All right, in today's Explainer, we are diving into the story of a drug that's made a truly incredible comeback, amitriptyline.
Think about it for a second. It sounds pretty unlikely, right? But that's exactly the story here. So let's explore the fascinating journey of a medication that was developed for one thing, but ended up finding a surprising and really powerful second life.
We're going to start with its origin story, how a drug that was a true pioneer in treating depression somehow evolved into a go-to weapon in the fight against modern chronic pain.
Amitriptyline's journey is really a tale of reinvention. You see, it was developed back in the 60s as a tricyclic antidepressant, and it was a frontline treatment for major depression. But fast forward to today, and it's actually more likely to be prescribed for chronic pain, things like nerve pain, migraines, and fibromyalgia. The fact that it's still a cornerstone treatment after all these decades, well, that tells you a lot about how effective it is.
So, how in the world can one drug do two completely different jobs? Well, the magic is all in how it rewires the brain's signaling system. This gets to the core of it all. What's actually happening under the hood?
The main mechanism is something called reuptake inhibition. Now, that sounds technical, but the idea is pretty simple. The drug boosts the levels of two super important brain chemicals, or neurotransmitters, serotonin and norepinephrine. It does this by stopping your brain cells from soaking them back up too quickly, which means they stay active and keep working for longer.
Let's walk through it. First, your neurons release serotonin and norepinephrine to send a signal. Normally, these chemicals are quickly sucked back up by something called a reuptake pump. Amitriptyline steps in and basically jams that pump. So what's the result? Well, more of these powerful chemicals hang around in the gap between the neurons, which essentially just turns up the volume on their signals.
But wait, that is not all it does. And this is where it gets really interesting, because what we call side effects are really just other effects. By blocking different receptors, amitriptyline causes a whole bunch of different outcomes. For example, blocking histamine is what makes you drowsy. Blocking muscarinic acetylcholine leads to that classic dry mouth. And blocking alpha-1 adrenergic receptors, that can make you dizzy when you stand up. It's a multi-talented drug for sure, but it's not always a tidy one.
So now let's see how this one drug, with all its complex actions, managed to build two completely different careers for itself in the medical world.
This comparison really gets to the heart of it. You see, for depression, it's now often a second or third choice, used to turn up the volume on mood signals. But for neuropathic pain, migraines, and fibromyalgia, it's a cornerstone treatment. And here, the goal is totally different. It enhances the body's own pain-blocking system, which effectively turns down the volume on pain signals traveling through the central nervous system.
Okay, so this brings us to the practical side of things. If someone is actually prescribed this, what can they expect? What's it like?
The absolute golden rule for doctors prescribing amitriptyline is start low, go slow. The dose is super individualized, and it's always increased gradually over time. This gives the body a chance to adjust, and it really helps to minimize those initial side effects. The right dose also depends heavily on what it's being used for. As you can see, for depression, a typical dose might be somewhere between 50 to 150 milligrams. But for chronic pain, it's often much lower. Somewhere between 10 and 75 milligrams is usually enough to do the trick.
And remember that powerful sedative effect from blocking those histamine receptors? Well, that's why this drug is almost always taken as a single dose right before bed. It's actually a brilliant strategy. It helps patients with sleep problems, which are super common in both depression and chronic pain, while letting them sleep right through the most intense period of drowsiness.
So, what should people be prepared for? Well, the most common complaints are drowsiness, especially at first, along with dry mouth, constipation, and some potential weight gain. Dizziness and blurred vision are also on the list, and these are all direct results of those other receptor interactions we looked at earlier. Now, for as effective as it can be, it is absolutely crucial to understand the serious warnings and potential risks that come along with taking amitriptyline. Okay, this is the most critical point. It's the black box warning from regulators, which is the most serious a drug can carry. It highlights an increased risk of suicidal thoughts and behaviors, particularly in younger people, and especially when first starting the medication or changing the dose. This makes close monitoring by doctors and family absolutely essential. A thorough medical history is also vital. This drug is generally not prescribed for people who've had a recent heart attack or have certain heart rhythm issues. It's also avoided in patients with specific types of glaucoma, severe liver disease, or those taking another class of antidepressants called MAOIs. And while they are rare, there are other serious risks to be aware of.
We're talking about potential effects on the heart's electrical system, seizures, and a dangerous condition called serotonin syndrome if it's combined with other specific drugs. This is exactly why close medical supervision is just not negotiable.
And finally, this is a medication you cannot just stop taking abruptly. Doing that can trigger a withdrawal syndrome, with symptoms ranging from nausea and headaches to anxiety and even a strange sensation known as brain zaps. It has to be tapered off slowly and carefully, always under a doctor's guidance.
So, after looking at its history, its mechanism, and its risks, what is the final verdict? Well, it all really comes down to a trade-off. Ultimately, amitriptyline's profile is a balancing act. It is a potent pain reliever and an effective antidepressant, but you have to weigh that power against a significant burden of side effects and the absolute need for careful medical monitoring. It's a really delicate balance.
And that's really the key takeaway. Amitriptyline is a powerful, versatile tool in the medical arsenal that can be life-changing for the right patient. But, and this is a big but, it's not the right tool for everyone, and its use always demands careful selection and supervision by a doctor.
And that leaves us with a final question to think about. The fact that a drug from the 1960s is still a go-to treatment for something as complex as chronic pain, is that a celebration of its incredible design, or is it a reminder that we still have a lot of work left to do? Something to consider. Thanks for watching.